my name is Peter Awin, and I'm from Ghana. I work with Cowtribe Incorporated. Cowtribe is into supporting farmers in rural areas in Ghana to access preventive animal health care. We've been working for almost 2.5 years now. We're mostly in the northern part of Ghana, and it's been more on trying to get more farmers to sign up to the services that we provide. Talking about impact, I think the biggest impact we've been able to make in the field of veterinary is being able to develop this system where farmers can now be able to access services without the need to wait for the vets to come. So we have an annual subscription model that we use to be able to get these farmers hooked to those services. So we have about 30,000 farmers that we currently work with. And every single month we provide services to help them prevent diseases in their communities. If you look at every African country, the biggest challenge that we face is access to services, especially to the remote places. Most services that are provided, talking about human health, education and all that, are mostly situated in the urban areas, and when you move a little bit out, you don't get certain services, and it's the same for veterinary services. In Ghana, we have very few vets. As I speak to you, we have less than 100 vets for a population of about 30 million people. So we're talking about a lot of farmers struggling to access certain services because the vets are typically not enough. And so you have a high mortality rate for certain species of animals. I can tell you for sure that in certain villages you can record as high as 70% of mortality for certain species. And so farmers lose a lot of their livestock because they cannot have access to these services. I have actually not been able to, to wake up to the responsibility to call myself a change maker. But yes, some way I can say I'm a change maker because the sector that I'm working with, it's not an easy sector. It's about animal health. Several interventions have been done across Africa in a quest to look for solutions to solve our animal health situation. Most of these solutions have not worked until we came out with the model that we currently implement, and we do see changes in the communities that we work in. We have farmers who are testifying to us that there is a change in their income levels. There's a change in access to certain services that they used not to have, and so I feel comfortable now to say we are making change, and I'm making change. But it doesn't rest in just me. I do believe that being able to work with other stakeholders in the ecosystem has really been helpful to bring a community of animal health practitioners who are interested in changing, and together we are doing this together. And I can tell you that in Ghana, we work at the district level, we work at the national level, we work with different actors, and it's really been like working together to bring this change, and not just about my organization. Yeah.